Today in emergency medicine, and in particularly where I practice, a high complexity teaching hospital, ultrasound is part of almost every encounter with a patient, and we use it for all purpose, for exploration, for diagnostic, and also for many of the techniques. When we talk about efficiency and wait times, ultrasound is really a game changer in emergency medicine because it not only reduces the time to diagnosis and therefore for treatment, it also increases safety and it reduces uncertainty. And that is very important in emergency medicine because we have a high density of decision making, and with sometimes very few pieces of information of the past medical story of the patients. And in the crucial moments with the critical patients, we need very much information to take the best decisions. My first impressions using the venue with the Vscan transducers was that it was exactly built in as I would expect, especially connectivity with the probe, and excitement would be maybe the way I would describe my first contact with the new machine. I would say the new venue in terms of interface and usability was very good because at first glance, my eyes went direct to the probe selector, and then I could find the Vscan probe. And without reading any guide before, I only tapped the button, and with only one screen indication, I could connect the probe easily and start scanning in a few seconds. In my opinion, venue makes the difference about image quality and portability. In a crowded situation like an emergency room, for us it's very important that we can take our ultrasound machine everywhere and the image quality is good enough to make good decisions. I was already used to the great versatility and portability of the venue family, but the new probes, the Vscan probes, takes this issue to another level. It's tremendous to approach the patient's bed, independently where the machine is located, and beginning to scan in the moment, and not depending of the length of the cable. And it's very comfortable, I think, for patients and also for practitioners. I can remember a case recently with a woman in her 80s that consulted for chest pain, and the image quality was decisive for the final diagnostic approach. The woman came for chest pain and had a quite normal EKG, and in the exploration room we performed an echo, and from the beginning in the prosternal long axis we could see a linear image in the LVOT, and when we turned the plane to the short axis we could see an aortic proximal dissection. So all our diagnostic workup turned this way, and we make the CT scan and confirm diagnostic. In that way, image quality impacted the result for this patient. We could gain crucial minutes for this patient, and maybe he's alive thanks to image quality. A situation where portability is especially important, I think it's in the resus room. It's a very crowded situation with very few space, and I was thinking about the last week where we have a patient that coded his arrival to the hospital, and the nurse staff had very problems to get an IV access. So when we start CPR, I was with my probe trying to get the first planes for the first diagnostic approach, and I had the feeling that I was getting in the way of the nurse trying to get the IV. And these are situations where a wireless probe, I think, it's more beneficial in the resus room and with this especially critical patient. I've tried other handheld devices, but the experience with the handheld device combined with a complete machine, it's very good because you have the best part of both worlds, because you have the freedom to move your probe, but you also have the image management and the measurement of a complete machine.